and welcome to How to Gastro. In today's video, we're going to be speaking about a very interesting and common topic, and that is the influenza virus. So let's get started. So what is influenza? Influenza is a viral infection that attacks one's respiratory system, specifically their nose, throat, and lungs. It is one of the most common infectious diseases and is a highly contagious airborne disease that usually occurs in seasonal epidemics. Commonly known as the flu, influenza is caused by a specific virus called the influenza virus. So from this definition of influenza, we get that it's a viral infection that specifically attacks the respiratory center in its human host and specifically causes inflammation around their nose, throat, and lungs. So as we all know, influenza is very common and very contagious, and all of us have actually suffered from the influenza virus before. So the influenza virus usually occurs in seasonal epidemics all around the world and is also commonly known as just the flu. So now that we know what the basics of influenza is, let's take a closer look at the specific subtypes of the influenza virus. So if we look closer into understanding the influenza viruses, there are actually 4 types of influenza viruses: A, B, C, and D. Human influenza type A and type B viruses cause our seasonal epidemics all across the world, and influenza C-type infections generally cause mild illness in humans and are not thought to cause human flu epidemics. So the majority of seasonal epidemics across the world are usually due to type A influenza or type B influenza. Influenza type D viruses primarily affect pigs and cattle and are not actually known to infect or cause illness in people. So what causes influenza? So the influenza virus travels through the air in droplets when someone with the infection coughs or sneezes or talks. One may become infected if they inhale these tiny droplets directly, or they pick up the germs from an object such as a telephone or computer keyboard and then transfer them onto their eyes, nose, or mouth. So if we can imagine, if one uses public transport such as a train, if one person who has the flu sneezes and the influenza virus droplets lands on the chairs, the windows, etc., more and more people will be exposed, because once they touch the surface, they can actually transfer these viral particles onto their eyes, nose, or mouth, and in this way they can also be infected. Also, if someone is sitting very closely to someone with the virus, the viral particles can actually be spread to them, and in this way they can become infected with the virus. Or if someone coughs or sneezes, a large amount of viral particles are actually released and can be spread to a whole host of people. And this is why the influenza virus is so contagious and so common in our specific countries every year all around the world. So now let's take a closer look at some signs and symptoms of the influenza virus. So usually people present with a fever, which is over 100.4 degrees Fahrenheit, which is around 38 degrees Celsius. They will also have aching muscles, chills and sweats, a headache, a dry and persistent cough, fatigue and weakness, nasal congestion, a sore throat, nasal discharge, and red and watery eyes. So how can one go about diagnosing an influenza virus? So influenza has traditionally been diagnosed on the basis of clinical criteria such as the fever and chills, cough, nasal congestion, runny nose, sore throat, hoarseness, etc. But rapid diagnostic tests, which have a high degree of specificity, are becoming more widely used today. The rapid influenza diagnostic tests, or RIDTs, are immunoassays that can identify the presence of influenza A and B viral nucleoprotein antigens, which are found in the respiratory tract from specimens such as throat, nose, or nasopharyngeal secretions. So these tests actually work pretty efficiently and are able to yield results in approximately 15 minutes. So usually the diagnosis can be made on the classic presentation of the patient. So if you go to your doctor and you say you have a fever, chills, congestion, and it's around the flu season time, we will attribute it to the influenza virus. But if we aren't sure, or your symptoms are a bit more sporadic or non-specific, we can actually use the rapid influenza diagnostic test. So here what actually happens is the throat, nose, or nasopharynx is swabbed, and the secretions that are collected are called samples. So once these samples are collected, they're actually put onto this test, and we can actually see whether the patient will test positive or negative for the influenza virus. Of course, the control will always have a line, but if the test line also appears, then we know the patient either has influenza type A or type B. And this is a nice, quick, and efficient way to test for the virus, and the results are actually available within 15 minutes, which is an absolute bonus. So moving on, let's talk about the treatment of influenza. So most individuals with influenza who are otherwise healthy do not need special drugs or treatments to cure this virus. But if one does have the flu, they can drink lots of fluids, eat a light diet, stay at home and get plenty of rest, take acetaminophen or ibuprofen to reduce their fever and relieve their muscle aches, take a decongestion in an oral or nasal spray form to reduce the swelling in their nasal passageways, take a cough syrup which can help calm their cough, take sore throat lozenges to soothe their sore throat, and they can also take several antiviral medications such as Tamiflu, Rapivap, and Xofluza, which are known to treat the influenza virus pretty well. And finally, the prevention of the influenza virus. So the Centers for Disease Control and Prevention recommends the annual flu vaccination for everyone aged 6 months or older. Each year's seasonal flu vaccine contains protection from the 3 or 4 influenza viruses that are expected to be the most common during that year's flu season. And this is usually country and region specific. The influenza vaccine also comes highly recommended by the World Health Organization for high-risk groups, especially women who are pregnant, children aged less than 5 years old, the elderly, healthcare workers, and people who have chronic illnesses such as HIV/AIDS, asthma, diabetes, heart disease, or are immune compromised, among others. And that brings us to the end of this video on influenza. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care, and bye for now.